Hi guys, today I'm going to discuss our estimation of graph using electrical activity. Electrical activity I have already discussed in detail in my previous video. Here is our graph. And outside we have galvanometer, whose needle is coming out from this galvanometer onto this paper. Actually what happened, our graph paper will move in this direction at the speed of 300 big squares per minute. What I mean by big squares, actually, let's suppose here I am drawing one big square and it has several small squares into it. So these type of 300 big squares will pass through this needle at the speed of 300 big squares per minute. So, and here we have positive, we have negative. This needle will fluctuate according to the electrical event occurring inside our heart. So let's recall our first electrical event. Our first electrical event was that SN node will fire inside the atria and electrical impulses will move towards downward direction and left side. So the net cardiac vector will be towards downward direction and left side. Due to this electrical event, the needle will fluctuate. This needle will fluctuate towards positive side. And will back to its initial position. And what will happen in second step? In second step, electrical signals will move through atrioventricular node, but because electrical signals will not be significant inside atrioventricular node, so atrioventricular node will be electrically silent, and due to which there will be no fluctuation in the needle of the galvanometer, and the graph will go like this. Electrical signals are moving at this stage through atrioventricular node. What will happen in third step? In third step, electrical signals will move from atrioventricular node to the interventricular septum, and the direction of electrical impulses will be towards right side and upward direction. So the net cardiac vector will be in this direction, and this will cause the fluctuation of the needle towards positive side and will back to its initial position. What will happen in our fourth step? Electrical impulses will move from interventricular septum to the major ventricular portion, and electrical impulses will move very fast to this region. The net cardiac vector will be towards slightly left side and downward direction, because near the left ventricle we have major portion as compared to the right ventricle. So electrical impulses will move very fast, due to which there will be dramatical change in our graph, and needle will fluctuate very fastly towards the positive side and will back to its initial position. And what will happen in our fifth step? Now in this step, electrical impulses will move from major ventricular portion to the basal ventricular portion, that is base of the ventricles. So electrical impulses will move like this, and the net cardiac vector will be towards right side and upward direction. our net cardiac vector will be towards right side and upward direction. Due to this, there will be fluctuation in the needle towards negative side and will back to its initial position. After that, there will be whole depolarization of the heart. At this stage, now the heart is fully depolarized. Now our heart is fully depolarized, due to which there will be no fluctuation in our needle. But after the depolarization, repolarization should also occur inside our heart. So there will be starting of repolarization inside our heart. The repolarization will start from here. This is the depolarization, where repolarization is starting. So repolarization is going like this, in this direction. Due to this event, due to the repolarization of our heart, repolarization of our ventricles, there will be fluctuation in the needle of the galvanometer towards the positive side, and again it will retain its initial position. However, in some rare cases, there will be the fluctuation, we call it as U wave, and that will be seen when electrical signals or electrical impulses are moving inside papillary muscles of our heart or Purkinje fibers of our heart. So now I would like to talk about the waves. Actually, this fluctuation, we call it as P wave. This is our Q wave. This is our R wave, and this is our S wave. And combinedly, it is famous for its name, QRS complex. And this is our T wave due to the repolarization of ventricles. Further, we have segments and intervals also. Actually, we have PR and ST segments. We have two segments. And ST segment. And we have intervals. We have PR interval, and we have QRS interval, and we have QT interval. Let me draw here. It's QT interval. So here we have waves. Here we have segments, and here we have interval. Actually, due to this electrical event, we have our P wave due to our second step, we have PR segment. Due to our third step, we have our Q wave, and due to our fourth step, we have our R wave. Fifth step will cause fluctuation of the needle towards negative side, which we called as S wave, and due to the deprioration of the ventricles, ST segment will occur, and due to the deprioration of our ventricles, our T wave will be formed. So these were the electrical events that how electrical events are represented on the graph, and what we called as ECG. So this is our ECG. I hope you have a clear concept now about the electrical activities, that how electrical activities are represented on the graph. I hope you enjoyed my video. Take care.